Well, if you have a low-risk prostate cancer, something called watchful waiting or close surveillance would be a very good option. Close surveillance means that you would be coming every 3 months. We would be looking at your PSA. We would be examining you. Every other year or so, we may get an MRI or another biopsy to make sure that the cancer is not advanced. This is for people who are compliant. They have low-risk prostate cancer, they may be older, and they may have a lot of comorbidities that we may not want to be too aggressive. In general, there are two major options and treatment options for prostate cancer. On one side, you have the surgery. On the other side, I call it the whole other bucket of treatments. Proton beam, CyberKnife, that we hear so many advertisements, that goes in the bucket of radiation. Seed implant, external beam radiation, HIFU, cryotherapy, all of them, they go in one bucket and surgery goes on the other bucket, and you're right at the fork. So what is the difference? What are the pros and cons, and what are some of the advantages? When it comes to surgery, we're removing the entire prostate, we're removing the sample of lymph nodes and seminal vesicles. You will be able to get a very accurate stage. How much cancer, doctor, do I have? What type of cancer? Where is it located? And that stage comes with surgery, but radiation won't give you that kind of answer. The other advantage of surgery is that your PSA after surgery should be 0 or undetectable. It's a peace of mind for the family to know that your cancer is gone and you're cured from this disease. Whereas a lot of times after radiation, there could be a couple of years, 18 months to 24 months, that the PSA can fluctuate, and that could be a major source of emotional distress for your family. With radiation, the prostate still remains in the body, so that patient may continue to need some biopsies, whereas the person who's had surgery probably won't need another biopsy, and you know those biopsies are not fun. And this is a very important comment I'm going to make right now. If your cancer ever comes back after surgery, the idea or having a plan B to have a low dose radiation after surgery is feasible. Whereas if you start with radiation, a lot of times if the cancer comes back, the surgery would be very difficult and challenging. So I want you to know this because not too many people is aware of this. Again, one more time, you start with surgery, you still have the radiation as an option after surgery. You start with radiation, surgery would be very difficult because the tissue becomes like a cement attached to the rectum and to the surrounding tissues, and it would be very difficult to do that operation. As you get older, because we have removed the prostate with surgery, you don't have to worry about the old man disease and enlarged prostate, whereas with radiation there may be some consequences of bleeding from the rectum, bleeding from bladder. So the risk of some of those side effects in the hands of experienced radiation oncologists would be less. But there's still a small chance of having a secondary cancer such as rectal cancer or bladder cancer at some point down the road after radiation. So I think it's important for you to get tested, talk to your doctor, understand about your PSA, make sure you put them on a graph and look at the trend of them. Always get a second opinion. If you're diagnosed with prostate cancer, understand what your Gleason score is, how much disease you have, and then we'll look at options. The main surgical treatment that we're offering to patients is called robotic, or as you know it as Da Vinci robotic surgery. This is a minimal invasive surgery where I've been devoted my whole career to this over the last 2 decades. I've done well over 7,000 of these operations with superb outcome, less blood loss, faster recovery, excellent sexual function, urinary control is superb, and with time it gets better, and we certainly can discuss that with you. The surgery typically takes about an hour and a half. There's no incision, keyhole openings. We bring in these fine instruments, and with magnification and better lighting and maneuvering around the prostate, we're able to do a beautiful nerve sparing that really not only cure them from the cancer, but also improves their quality of life, which is important. So I hope this information is helpful to you. I hope that you study this. If you have questions about anything related to elevated PSA, men's health, I encourage women out there to really ask their boyfriend or husband, do you know what your PSA is? Why are you getting up in the middle of the night? Do you know what your testosterone level is? How come you're not so interested in sex, etc.? All of this plays a big role. If you're diagnosed with prostate cancer, call us. I'm happy to help you for a second opinion.